Hi, I'm David Pope from Clinical Edge, and welcome to this week's 5-minute physio tip on lateral elbow pain. So, lateral elbow pain is super common in your athletes, your tennis players, your manual workers, and your computer workers. I had a patient in a few weeks ago that presented with lateral elbow pain over the lateral epicondyle, pain with gripping, carrying items, also pain with boxing, and pain with elbow flexion supination more than extension pronation. So, does this fit your pattern of your normal lateral epicondylalgia? Well, the pain with gripping and activity leads you towards it as well as the area of pain, but one of the things that really doesn't fit that pattern of lateral epicondylalgia is lateral epicondylalgia is generally worse with your elbow extension pronation as opposed to your flexion supination. So in this case, flexion supination was the most aggravating position, and that's more of your elbow's closed pack position. So it leads you more towards some irritation around the elbow joint, and so that leads us there. The fact that extension pronation makes it feel a bit better leads you more away from your lateral epicondylalgia. It's your source of symptoms. It also had some really good physio that incorporated strengthening for the wrist extensors in all sorts of positions, none of which had worked. So we've got a bit of an idea that the elbow joint is likely to be involved, and then we can head into assessing that with our objective and then into our treatment of it. So that's where we went, and we got stuck into some objective tests to identify where his range of movement was. We performed some joint mobilisation at his elbow and some mobilisation with movement, and really quickly within that session, his elbow range of movement, his flexion supination, his pain levels went right down, as did his range of movement improved as well. So we had a really nice within session change in his elbow range of movement that had been led there by his history. And this is where your subjective really helps to guide your diagnosis and then your treatment. So we'd identify that he didn't really fit that normal pattern of lateral epicondylalgia with extension pronation, but it was more of that elbow closed pack position that was irritating it. So we sent him away with performing some self MWMs and joint mobilisation, really easy for them to do. He came back for his second session much improved, so 95% better, hardly any pain and full range of movement. We then can start to incorporate some strengthening then. So we'd stopped his elbow strength, his forearm and wrist extensor strengthening on that first session. We're now able to incorporate some strengthening for all the other muscles around his elbow that he hasn't been able to use so well for the last 6 to 12 months while he's been experiencing this pain. So we started with some biceps and triceps strengthening, and then incorporating his mobilisation with movement. If there's any irritation with that strengthening, he can use that mobilisation with movement to settle it back down straight away. We're next going to incorporate some strengthening for his forearm, his flexors, extensors, and also around his shoulder as well. So we're starting to address all the components around the elbow, but the important thing is we identified what was going on in his elbow first from his pattern of movements, then headed down that path of identifying his restriction and range of movement impairments, and then treating that, looking for a change, and then starting our strengthening program. So I hope that's given you some good ideas about with your next lateral elbow patients to identify to get their diagnosis right. So looking for if it's a more normal lateral epicondylalgia patient, that extension pronation position to be more aggravating, and your elbow closed pack position with flexion supination for it more to lead you towards that elbow joint as the source of their symptoms. So I hope you enjoyed this week's 5-minute physio tip. If you found us anywhere else besides on our blog over at clinicaledge.co, head on over and check us out. I'm going to catch you on the next episode of the 5-minute physio tip.